Cold, the common cold is back. So my name is Dr. Noha Polak. I am a pediatrician. I've been practicing pediatrics in Union City and Bayonne, New Jersey since 1996. I'm happy to be speaking about common colds again because that's what we've been seeing in our practice. So the COVID numbers are going down in our community. I'm glad to say that we're now in the yellow zone, which is moderate, much better than the very high and high where we've been. Our test positivity rate is 1.2%, which is much better than it's been. So a lot of the kids coming in are having common colds, but we can't tell the difference between a common cold and COVID. So what do you do as a parent if your child has cough, runny nose, even fever, and a little crankiness? So that depends on the situation. If your child is not in daycare and they don't go indoor around a lot of people and they've had no sick exposures, especially no exposures to COVID, you can stay home and just take care of them like we tell you with the saline and increase their fluids, get them some steam in a steamy bath to help them breathe better, but not much more than that. But if your child is in daycare, especially if they're in daycare and they have fever, or if they're coughing enough to keep them up at night or to decrease their intake of food or fluids, then you should consider calling us and bringing them in. What will we do if you bring your child in for these symptoms? We will take a history, including where they've been in the last couple of weeks, if they go to daycare or not, if anyone around them is sick, especially parents, if the parents are vaccinated, because that makes a difference in how we manage your child's illness. And once we take that history, we will do a physical exam, of course, where we check everything head to toe and make sure that there are no bacterial infections that need to be treated. So if there are no bacterial infections, then we decide with you, mom and dad, if you would like to get the child tested for COVID. Now, many daycare centers and schools are requiring that children who've had either coughs or fevers or both be tested for COVID. So yes, we would do a COVID PCR in our practice. The great majority of these tests come back in 24 hours, sometimes 48 hours. So that will help you to figure out what to do, and that will also give the reassurance to the school or daycare center, and soon to be camps, actually. So the recommendations for common colds is in terms of treatments are honestly not antibiotics. So we will not prescribe your child an antibiotic if it's a common cold. What do? We recommend that you use saline if your child is young and they cannot blow their nose. So saline in the nose can help to clear things out and you can suction it. If your child is old enough to use saline on their own nose, that's even better. A steamy bath is usually helpful, or a humidifier. If your child has fever or pain, Tylenol or ibuprofen is the right thing to give them. And if you don't know the doses, or if you need our help to determine whether you should bring your child in or not for common cold symptoms, we'll be glad to have a conversation about that with you, either via phone or via televisit, because you'll be surprised how much we can tell by looking and seeing how well your child is breathing or not. So if you need our opinion, please call us. If it's a common cold, we'll help walk you through it. If there are risk factors for COVID, we'll ask you to come in, where we'll do a full exam as well as do a COVID test that comes back relatively quickly. We also do have the rapid COVID tests in the office, and we always back them up with a PCR. So if your child is sick, very sick, we will do a rapid COVID test and a PCR to make sure everything is taken care of for them. So I am hoping that the numbers for COVID continue to go down. I am hoping you have a great, healthy summer. And I wanted to give you those tips about what to do if your child has common cold symptoms. As always, Progressive Pediatrics in Union City and Bayonne, New Jersey is there to take care of your children. We're open 7 days a week in Union City and 5 days a week in Bayonne. And we would love it if you would give us a Google review if you have a moment. Please share this video with your friends or family if you think they're interested and if you like what we're saying. Have a great day. Bye-bye.